Sabrine. I will be a nurse today. How are you doing today? I have an order from your doctor of changing your abdominal dressing. I gave you a pain medication 30 minutes ago. Do you think it's helping you? Okay, it is. Okay, thank you. Also, 0 to 10, how pain your level of pain is? 3. Thank you so much. Okay, I'm going to. Can you tell me the name and the date of birth? Okay, thank you. So now I'm going to provide privacy. I'm going to gather my supplies here, my stereofield supplies. I'm going to adjust the bed in comfortable walking height. So today we are doing stereofield, so I want you not to touch your womb area. You can get bacteria infection there. I don't want you also to touch my hand when it's sterilized, also any of the supplies. Thank you so much. I'm going to wash my hand and I'm going to put some gloves on. Okay, I'm going to expose you a little bit the womb. Not too much. I'm not going to do too much. I'm also going to expose only the area that I'm working on. Okay, it's going to hurt a little bit, okay? Try to breathe through it. Also, I forgot to say that I'm also applying my BBE, which include goggles and mask. Okay, now I'm going to build this one. I'm going to pull it parallel to the skin toward the dressing. I'm going to make sure it's away from the patient so they don't see it. I'm going to take one by one. Okay, this one is going to hurt a little bit, okay? Try to breathe through it. Okay, thank you. I will be gentle. Okay, I'm going to dispose them into the trash. Also, I'm going to observe them. I'm going to take off my gloves. Put it on the trash. Wash hands. Now I'm going to observe the womb. Make sure any excessive drainage, any color, any smelling, anything that I see that I can record it after the procedure. I'm going to do that. Also, I'm going to measure it without touching the womb area. That's 13 centimeters. Also, I'm going to measure the width. That is 3 centimeters. Okay, now that I do that, I'm going to make sure that my supplies and my stereofield is ready for me. I have them here. I have my supplies here. I'm also going to check the date of my supplies. I make sure that, okay, after I do that, I'm going to make sure that my tape is ready for me since I'm putting gloves on. I make sure that when I'm walking on this area, I'm out, my body is away from the stereo area, that I don't touch anything. Okay, now that that's ready, using one hand, I'm going to do away, only touching outside. If I think I cannot touch here, which is still the 1 inch away. I'm gonna do side. I think I touch a little bit inside. I break stereo, I will know that. Also, I'm gonna touch outside. Okay, touching outside, I'm going to adjust my dressing. Okay, I'm going to put everything here. Make sure I don't touch inside. I'm going to put it on the trash, away from my body. Trash. A little bit difficult. I didn't touch inside. Now that I'm hiding the label, I'm going to put some solution in here. Now that everything is ready for me, I'm going to put the stereo gloves. Starting with my dominant hand. Okay, I'm gonna start with my dominant hand, away from here. I'm going to one of my stereo glove is cut a little bit, so I'm gonna make sure that I don't touch inside. I didn't touch outside. We'll try to be careful. It's not helping. Okay, I'm gonna place 2 fingers to make sure that I don't touch anything else. I'm gonna place my other hand here. Now I'm going to kind of fix since they're both sterilized, I'm going to fix them. And if I break any sterilite, I'm going to kind of redo it. Touching inside, I'm going to put this one on the trash. Okay, now that I'm sterilized, I'm going to tell the patient again that I'm sterilized, so to be careful about my hand and the womb. Okay, now I'm going to clean the womb. I'm going to start the center. صدرك. Put it on the trash. I'm going to get another one. Farthest away. Put it on the trash. And close the side. Trash. And then for this one, I'm using for around, if it's like a lot of drainage around, I do that. Put it on the trash. Now that we do that, I'm going to cut this one. Not too long, not too short. Okay, it's going to hurt a little bit, okay? Now I'll make sure that I don't touch the outside skin. Make sure I be careful touching any outside. I'm sorry, it's going to hurt a little bit, okay? Now that everything, they're all inside, I'm going to cover the womb up. Using this 4x4. Now that my tape is ready for me, I'm going to tape it up. Okay, I'm going to take off my sterile gloves now. Put it on the trash. I'm going to cover up my patient. How are you doing? How is the procedure? How are you feeling? I'm going to make sure the call light is reachable. I'm going to lower the bed. I'm going to wash my hands. I'm going to wash my hands. I'm going to wash my hands, put new gloves on. I'm going to clean the area that I walk on. I'm going to dispose all the supplies that I use. I'm going to report any infection, that if it's any infection, any bleeding, anything that's abnormal that I see, immediately to the physician. Also, I'm going to record and report everything that I did today and any finding with the old dressing, anything, how the womb look like. I'm going to report that. I will also make sure I report how the patient was doing during the procedure. How the procedure was going for you. I'm gonna ask you those questions and I'm gonna report that. Thank you.